The Kolebu Teaching Hospital Polyclinic has stopped admitting referred cholera patients from other government hospitals. The cholera unit is congested, with some patients sitting on benches at the corridors to receive treatment. Jerry Akuno's report.
The cholera unit of Kolebu Teaching Hospital Polyclinic would need 4 days to decongest after admitting many cholera patients. At 3 p.m. on Thursday, the cholera unit had recorded 30 cases. So far, 1,000 cases with 12 deaths have been recorded since the outbreak in April 2014. Wards are full and some patients had to sit on benches and chairs to receive treatment, while some structures had been converted into clinical days.
If any government hospital or polyclinic gets a case, the person have to treat. Don't refer. If you refer to us, we will refer it back to you. We still have 60 already who have been here since 3 days, some have been here since 4 days, and then we've added 30 to it today. So as at now, we've hit 1,000.
Cholera is contracted by eating foods and drinking water contaminated by fecal matter. It is also contracted through poor personal hygiene. A focal person for disease with pandemic potentials at the Ghana Health Service, Alhaji Sufyan Abubakar, said the public should practice good hygienic practices to avoid infections.
We all know that cholera is a germ which is found in feces, and literally we say if you have cholera, it's like you've eaten somebody else's feces. In these times when we have cholera everywhere, we insist that you drink clean, safe water.
The Accra metropolis has recorded the highest number of cases since the cholera outbreak.
Still on health, and First Lady Lordina Mahama says there is need to urgently resource all district and regional hospitals to be able to fight the cholera outbreak. The First Lady, who presented some medical items to hospitals in the Volta region, noted Ebola and cholera must be tackled urgently.
In the wake of cholera outbreak in the country, concerns are rife about the country's preparedness to fight it. Equipping health facilities with medical logistics and equipment has become crucial. The First Lady, Lordina Mahama, through her foundation, has donated medical items to some hospitals in the Volta region. Madam Lordina Mahama was hopeful the supply will help improve healthcare delivery in the districts.
We are lucky that the Ebola virus has not affected any of our people in Ghana, and government is committing resources and enforcing security at our borders to manage any infection.
The Lordina Foundation gave out 123 boxes of medical equipment to the Ketekrachi District Hospital to help wave off some of the pressures on the facility. The chiefs and people of the area and the hospital authorities were grateful for the gesture. At the Nkwanta District Hospital, the supply of the medical items came as a relief for the authorities of the facility.
The local as well as the national economy will not grow if the people are not healthy. In the past, our towns were actually renowned for their stellar health facilities. The government is committed to improving health facilities across the country to those stellar levels.
The people and elders of Jasikan Government Hospital were also happy with a new set of equipment to support healthcare delivery. The foundation also presented similar items to the Kwando District Hospital.
So we're still focusing on cholera, and during the headlines I did mention that over 5,000 cholera cases have been recorded, and we're moving back to the Kolebu Polyclinic, where we've done a series of stories on looking at the outbreak to find out if the situation has changed at all. So we'll be speaking shortly with Abigail Owusu. She is a disease control officer at the Kolebu Polyclinic. Do I have Abigail on the line?
Yeah, hello.
Good afternoon.
Afternoon.
Now, is the polyclinic still recording new cases?
Yes, please.
So what's the situation like now?
It's a bit calm, but they are still coming. We are still receiving new cases. since 6 o'clock till this time, it's recorded 25 new cases. Yes.
So making the cases there?
Pardon?
It adds
Hello?
up to the cases there already. So what's the figure now?
Right now we have 1,030.
Now, we spoke to you early on in one of our stories, and you did indicate that because of the congestion, you won't be taking referrals. Are you still getting referrals?
No, it wasn't like that. We said because of the situation, you can see that every government facility is choked now.
Yes.
So if any government facility gets a case, the person should manage it. They shouldn't refer to Kolebu. But we didn't say we won't take new cases. The saying was we will not take referrals from other government facilities, but we are still taking new cases.
I just, that was what I meant.
If is being referred from private, we do accept. But from another government hospital, we wouldn't. Because since they think the place is choked, so they won't receive the cases. And they come and then they refer to.
Can you speak up, Abigail?
The same thing happens to us. We are also choked, but so we are receiving the cases. But we don't want referrals from government facilities. That is what we meant.
So is that to say that if I want to find out from what you've built on, are you still getting referrals from government hospitals?
No, they are not coming again.
Okay. Now, another concern is that when relatives of patients bring their, probably when relatives bring their relatives who have cholera, they go back home with the disease. And usually when these patients or new cases are being brought into the polyclinic, what's the mode of transportation?
Some are being brought in by taxi.
And are these taxis disinfected?
That one I can't tell. But we do talk to the taxi driver that this is the case you brought and you can easily get it. So far as you are a public...
Can you speak up, Abigail?
A public car, and then people will still be boarding the car. You should disinfect your car. We talk to them. And then to the relatives, we do, when they bring the patient, we send them to wash their hands and then talk to them that when they get home, they should make sure their dresses that they wore to the place, they wash it with either Parazone, that is bleach, or Dettol.
Another challenge was the lack of logistics, talking about disinfectants and gloves, which has been a concern at various health facilities. Has your situation changed in any way?
Yeah, we have the logistics. We have the fluids, we have the disinfectants, we have the antibiotics being given to the patients. We have everything now.
But congestion...
Our only problem is the beds for the patients. Because as of now, so patients are still sitting in plastic chairs for the past 3 days. And then they are still seeking treatment. So if the person sits in the plastic chair for 3 days and he gets better, we discharge. Because there are no beds for the patients to sleep on.
All right. Well, thank you very much, Abigail. Abigail Owusu is the disease control officer at the Kolebu Polyclinic, and we're looking at the cholera situation there. She did mention that they're still recording new cases at that facility, but we'll bring you some more situational reports across the country. Remember, you can get interactive. Facebook and Twitter is News on TV3, and I keep telling you, and like I mentioned earlier on, that we have recorded over 5,000 cholera cases, and we'll be looking more into it. We just looked at the situation at the Kolebu Polyclinic. We'll try and reach the La General Hospital and our correspondents in some parts of the country to see the situation there. But if you live in around a health facility or probably have a relative who has cholera, you can share your experience. Facebook and Twitter is News on TV3. Alright, so we're moving straight to the La General Hospital, where I do have Philip Cotto. He is administrator of the hospital, to tell us more, looking at the cholera situation at the La General Hospital. Good afternoon, Philip, and thanks for your time.
Good afternoon, and good afternoon to your discerning listeners and viewers.
Okay, now we just spoke with Abigail Owusu from the Korle Bu Polyclinic, and she did mention that they are still recording new cases at the facility. Is that the same situation at the La General Hospital?
Yes, we are receiving cases on a daily basis.
And what's the cholera record you have there now?
As of last night, we had 29 new cases reported at the La General Hospital. That shot up the number since we started on the 9th of July, that we recorded the first case, to 914 cases, which we have seen so far and have discharged some of them.
And the issue about the lack of logistics, gloves, water, disinfectants, health personnel work with, is that still a challenge at your facility?
I wouldn't describe it as lack. Lack would mean that we do not have anything at all, but I would say that inadequacy of the logistics. Talk about the disposable gloves. Now the consumption rate for those things very, very high. But I think that they are inadequate, not that we lack. But all the same, if benevolent organizations and individuals who support us, would appreciate it to continue to save lives.
So how are you managing the situation, since what you have there is inadequate?
Come again?
How are you managing the situation?
Oh, as for our cholera bay, can take only 13 patients. It used to be a tent, but because the tent could not stand the weather, that gave us the impetus to replace the tent with everything from the hospital's own internally generated funds. And so because the cholera bay can take only 13 patients, that's how come we are nursing some of the patients on benches actually at the OPD. And so the problem at the moment is space. We are challenged by space. But the fortunate thing is that because we are not keeping this 900, we are actually treating and discharging. That is helping a bit.
But treating and discharging to ensure that they are well and okay before they go home, or they come there and then they go back to the...
In fact, there's no point in keeping you there if we think that you are stable medically to go home. And so they are not patients like because we do not have the space and we are just pushing them back home. No, we actually treat them when they are stable, they are discharged.
And quick one, going back to the issue relating to the inadequacy of logistics, what happens when you run out?
Oh, I must say that since we've been dealing with the situation, fortunately, some individuals and organizations have been giving us some logistics, and we've been buying some ourselves. So that's how come I said hitherto that I will not describe it as lack. And I must take the opportunity to say thank you to NADMO. They've given us some mattresses, and JMRDO, a company, McBell's, and even yesterday, the office of the First Lady, Lordina, Her Excellency Lordina Mahama, sent some consumables like gloves to us.
Okay, well,
and we appreciate them, including Rotary Club of Airport.